Okay, so I'd like to introduce myself. I am Jodi Pearce, a health promoter at the Windsor Essex Community Health Centre Teen Health. Many people know the Windsor Essex Community Health Centre as Teen Health Centre. Both are accessible either by looking it up online or the telephone. Services are free and confidential. And one of the things that we do talk about at Teen Health and many of our other organizational sites as well are services for young people as well as just individuals in general who may identify as lesbian, gay, bisexual, or transgender. So we do have support workers, medical staff, counselors, dietitians, psychologists that will certainly see individuals for any reason, but that could be one of them as well. So today we are going to talk about inclusivity, health, and mental health. So what that means is generally inclusivity is a noun. It's the fact or policy of not excluding people on the grounds of gender, race, ethnic orientation, or their sexual orientation, disability, etc. So inclusivity is something that we'll be discussing today. It's something that is in the curriculum. It's talked about as early as grade 4 in school, all the way up through into high school as well. So what are we talking about? What do the terms sexual orientation and gender identity really mean? Well, those terms are defined as sexual orientation is the emotional, physical, or romantic, sexual, and spiritual attraction, desire, or affection for another person. It's who they are attracted to. Gender identity is a person's own individual identification and how they describe themselves as female, male, intersex, masculine, feminine, transgender, or transsexual. So being mindful that sexual identity and sexual orientation are a person's life, not a lifestyle. It's something that is how they define themselves, and it's their life that they choose to lead. Many of the key terms or many terms that people use to identify themselves. There are terms in our community that are deemed appropriate. Some are deemed maybe not appropriate. But some key terms that many of us have heard in the community and in our day-to-day life are words like sexual orientation, bisexual, polysexual, genderqueer, intersex, two-spirited, and transgender. So one of the terms, gender identity, we all have a gender identity. It's how we describe ourselves. It's a deeply experienced sense of what one's own gender identity is. For trans individuals, it's a sense of gender identity that may or may not be the same as their biological sex. So their gender identity may not match the sex that has been assigned to them at birth. Gender identity does not tell you anything about someone's personal behavior or their sexual orientation. They may be two and are two individual definitions. Some key terms that we often hear in our community and more commonly in around not just the LGTBQ community, but in school, in workplace, in our family, are terms such as bisexual. It's a word describing a person whose sexual orientation is directed towards men and women, though not necessarily at the same time. Polysexual is sexual orientation that does not limit affection, romance, or sexual attraction to any one gender or sex, and which further recognizes there are more than just two sexes. Genderqueer is a term that has been coined more recently by younger people. It's by young people who experience a very fluid sense of both their gender identity and their sexual orientation, and who do not want to be considered by absolute or static conceptualizations. So they may identify as both and as well both male-female and be attracted to both male and female as well. Intersex is a person who has a mixture of male and female genetic and or physical sex characteristics. Two-spirited is a term that is coined to reflect specific cultural words used by First Nations and Indigenous people. It is a word that Indigenous people are proud of. It is respected, and it is for people who identify as gay or lesbian or transgendered or transsexual. They have multiple gender identities. It's a term used reflected by First Nations people or Indigenous people in their community to distinguish their concepts of gender and sexuality from those of the Western LGTBQ community. Transgendered is a person whose gender identity is different from their biological sex. So they identify as male or female, but their biological sex may not match that of how they identify themselves. The continuum of sexual orientation is something that we know of as going from possibly exclusive heterosexual to exclusively attracted to someone of the same sex. So, and anything in between there. So there's many different terms that fall into place. People, how they identify themselves. It's a spectrum or a continuum, whereas people may fall at any given time. Sometimes they may identify themselves as a lesbian. Sometimes they may identify themselves as bisexual. And there's no, it can be any range in between the two ends of the continuum. It's also not one or the other, and it may be ranging from someone who identifies as straight to someone who identifies as lesbian, so anywhere along the spectrum. Young people, why is it so important when we talk about young people and the LGBTQ community issues, or however that is that one would like to describe that? But for young people, they may identify themselves and know at a very young age that they may be attracted to someone of the same sex, that their biological sex doesn't match how they may want to identify themselves or see themselves. Therefore, there's lots of maybe questions that they have. They're not sure how they feel. They're not sure how to describe how they're feeling. So in terms of the coming out process, it's something that may take a while. It's something that's not just a one-time event that they've come out to whomever it is that they choose to come out to right away. It's an ongoing process. It's something that often young people or people in general may fear because it would be different. They may have a different sense of coming out to their family versus their friends versus their coworkers. So this is something that, again, is not a one-time event. If I've come out to my family, it doesn't automatically assume that I have come out to all of the people that are in my life. It's an ongoing process. It's something that many people think about for a long period of time, and again, may make some choices to come out to some people, no one, different groups of people, and versus not other groups of people as well. So sometimes there's fear involved in the coming out process. Especially for young people, they may fear reprisal, they may feel retaliation, they may feel that they are going to be bullied. They're not sure of reactions or responses from the people around them, whether that be family, friends, teachers, coaches, or whomever. So that coming out process, like I said, is an ongoing process. In its different stages of their life. It's not linear, it's not that one-time event. So it might be a choice that they do early or young, depending on how their own feelings are, as well as the support that they may receive from the people around them. So lots of choices around coming out. It's something that the young people or people in general are constantly thinking about. Especially when it comes to dealing with those different groups of people. It's a personal choice whether to come out or not to come out, who to come out to, and maybe whether they choose to not come out to individual groups as well. It's a personal choice, and often people have to sort of experience it with different groups and how the responses or reactions that they get, and make some choices and changes as they go through that coming out process. So when we talk about health in general, we are talking about everyone. Everyone has health. Everyone has good days, bad days, mental health, physical health, spiritual health. And for young people, different sets of health concerns versus senior citizens versus, income, poverty, education, not just based on some of the demographics that they have, but even in terms of their genetics and how well they take care of themselves. So for example, LGBTQ people have many of the same health concerns as everyone else. So everyone that's living around us have the same concerns. It's no different. Cultural differences, though, however, may have an impact on the health of LGBTQ people because of discrimination for different things that might be going on in their family, the impact of homophobia, transphobia, and even some kind of systemic discrimination. It means that their health needs may be experienced at a much different level than those who don't identify as LGBTQ. So what is the difference? When we're talking about health, we are talking about physical health and well-being, our spiritual health, our mental health as well. So what is the difference between the two? And I like to say that there is a difference between mental health and mental illness. Mental health is something that we all have. It is a state of well-being in which an individual realizes their own abilities, their ability to cope with everyday stressors, to be able to work through those stresses of life, work productively and fruitfully in their community, and make a contribution to their personal life, their family, their friends, their employers, as well as to themselves. So it's a normal functioning of life. We all have a mental health and our ability to do all those things, and all of us may be on a different range or a different level depending on some of the experiences that we may be going through personally, even genetically as well. Mental illness is a health problem that significantly impairs a person's ability to behave or interact and think. So it's an impairment, and not everyone has a mental illness. Some of us may be more predispositioned to mental illness. However, there is a difference between having mental health, which we all have, and a mental illness, which we don't all have. It has to be diagnosed according to certain criteria, and usually by a specialized physician, doctor, psychologist, psychiatrist, whoever that person might be, social worker. So again, there is a difference between having a sense of mental health. What is my mental health and well-being? And do I have a mental illness? It's not something that I can just make up and toss around. It's something that should be diagnosed and dealt with accordingly. So what does that mean? When we are mentally healthy, we can absolutely form positive relationships. We're able to function. We're able to get through, again, those daily stressors. We're able to meet life's challenges, reach for our full potential. So we have all of the ability to do what it is we need to do. But a mental health problem exists when it interferes with, when something is interfering with our ability to form relationships, perform academically, perform in our work place, even able to get through some of the things in our family life as well. But in terms of the mental illness, it might be at a lesser extent than just a mental health problem. So again, when we talk about LGBTQ individuals who have or have not maybe come out to the people around them, but they've maybe self-identified, what happens is that we normally see that there are some unique health concerns for individuals who identify, and they may be at risk for certain health issues, and this is because they're struggling often, not always, but they're not sure. It may take a little bit longer to talk to someone, to find someone who's supportive, to be able to talk to their physician or a social worker, maybe even talking to a friend or a teacher or a coach or someone who's trustworthy in their life, because they're not sure of who to turn to and how. I think that fear of reaction, first and foremost, to their how they may identify themselves, and then getting the help that they need from someone who's competent enough to be able to ask the right questions and move them in the right direction. So most health care providers are not specifically trained in LGBTQ issues. Health needs, they may not be sensitive to particular health concerns as well. They may not be as knowledgeable or comfortable when someone discloses that they identify as lesbian, gay, bisexual, or transgendered. So again, it could be a roadblock for some people accessing some of the support services that they may need in their life. When we talk about a mental illness, again, it doesn't specifically apply to the LGTB community, I think that everyone is at risk for having a mental illness. We, again, if we want to discuss the difference between, we all have mental health. Not everyone is going to be predispositioned to a mental illness. But some of the common mental illnesses that do exist for everyone are things like anxiety, schizophrenia, bipolar, mood disorder, personality disorders, eating disorders, and depression. These illnesses may be referred to as a mental disorder, a mental impairment, or a psychiatric disability. So something that would be maybe genetically more inclined to interrupt their daily functioning, something again that has to be assessed and diagnosed by a specialist. Not everyone has the same ability to come through with a mental illness. Some people are just a little bit more prone than others to, just based on either genetics or a problem that may be happening in their life. So in terms of mental health issues and the LGBTQ community, there are some statistics and resources that tell us locally in terms of Ontario how, yes, some people who identify are maybe more at risk of in terms of getting the help and support that they need, talking to individuals, finding someone who's competent enough to be able to help them and move them in the right direction. So according to Rainbow Health Ontario, the LGBTQ youth have been shown in a Canadian study to demonstrate a risk for suicide that is 14 times higher than those of their straight peers. And as well, in a larger study, statistically representative of trans individuals in Ontario, found that over 60% had symptoms of depression, 77% had seriously considered suicide, and 45% had actually attempted suicide. Trans youth aged 16 to 24 are especially vulnerable, with 19% reporting suicide attempts in the past year, compared to 7% who are 25 and older. LGBTQ youth at school. So young people usually have an idea and have, again, either disclosed or not disclosed to themselves or others about how they may identify themselves. And sometimes this is because of things that may be going on in schools. I do know that many of our school boards across Ontario are making greater efforts to make a safer place, a safer schools. GSAs are mandated and accepted in every high school across the province, and only a few statistically have chosen to go ahead and start one, have one completed, sometimes even as early as in the elementary level as well. But they are a good source of support for young people who identify as gay or straight, or they may just be an ally, and again, they may just go through different topics and talking about social justice ideas in their school, supporting those who identify as LGBTQ, or even just general issues at their school or in their community. But again, it's a great resource and support system for many young people in high school and even in elementary school. So in terms of in school, over 90% of LGBT youth do report that sometimes or frequently they do hear homophobic remarks, whether it be in the hallway, in the classroom, or on the playground, maybe at recess, or the school bus area. So somewhere inside or outside of the school, that they do report hearing homophobic remarks either by other students, teachers, maybe custodial staff, bus drivers, patrols, whoever that might be. So it does exist. 36% of LGBTQ youth have heard slurs from faculty or staff. LGBTQ youth are almost twice as likely as their non-gay peers to be threatened with or injured by a weapon at school. And they are also 4 times more likely to skip whole days of school based on fear of going to school, fear of reprisal, fear of harassment. Harassed youth are more than 4 times as likely to report having made a serious enough attempt at suicide to be able to have to either go to hospital or tell a professional in their life that they need help or support. So one of the things that we can do, many of us, for individuals in our life, is become an ally. So be that voice, be that advocate for somebody who needs support, whether it's a disability, whether it's someone who identifies as LGBTQ, someone who is just on the shy or quiet side, maybe not able to speak up for themselves. Maybe they do suffer from a mental illness or have some sort of impairment that stops them from being able to speak up for themselves and have a voice. So that's one of the things that I often encourage young people to do, is be an ally and be a voice for those around us. So one of the things that we can do for our youth, especially those dealing with internal struggles like sexuality, they need heroes, they need guidance, they need people like us that can step up to the plate and be supportive in the times when it feels that no one else is being supportive for them. So it's become more apparent that there are many examples and role models that LGBTQ young people are not seeing. They don't see people who reflect how they feel. They don't in their lives. They don't see people or hear people who look like how they feel. So oftentimes in a school, a teacher may or may not identify as LGBTQ. So a young person may be really forced to see what appears to be many straight individuals that surround them, which further may cause some isolation and issues and feeling, or that sense of I'm all by myself, I'm alone, I'm the only one that feels this way. So oftentimes it's important for us to encourage other people to have things like a Gay Straight Alliance where many people can come together and be in a safe space and discuss issues, or just have general discussions overall as young people would. So being an ally are some of the most effective and powerful voices in the LGBTQ movement. Not only does an ally help people in the coming out process, but they also help understand where that person has been, where they're going. Also reiterate the importance of equality, fairness, acceptance, and mutual respect. So having that extra person who can listen, who doesn't have to form an opinion, who doesn't need to tell someone how they feel or what's going on, or this is how other people are seeing things, but just to be that ally to listen and ask if there's anything that I can do to be supportive. Is there anything that I can do to help, get support in the community? Can we do things together? What is it that that person needs or wants, and being there for them. So 10 ways to be an ally, many different ways these are just 10 that I've sort of come up with help online. So first and foremost, it's important to be a listener, to listen to what that person is going through, what their needs and wants are. Being open-minded, not judgmental or passing on an opinion that we may have. Being willing to talk to that person with them about what it is that they're discussing, their own individual issues, or not, just listening and talking about things in general. Being inclusive and invite LGBT friends to hang out with your friends and your family, and inviting them into your environment and your world, so that it also increases a sense of acceptance and belonging as well. Not assuming that all your friends and coworkers are straight, which also leads into the next one, that any anti-LGBTQ comments and jokes, that they are very harmful, and letting friends and family know that that's not acceptable to speak that way, to say things like that, or for anyone to be hearing comments such as that. Confronting your own prejudices and habits and thoughts and opinions, which can be difficult because sometimes we do have things that we've thought about, things that, the way in which we feel that may or may not be congruent with some of the things that we're trying to do as an ally. Standing up for your LGBT friends against any discrimination by maybe saying, hey, that's not acceptable, or that's hurtful, or that can be really be harmful, or how do you know, is that factual? Maybe just don't say those things as well. So really stepping up for that LGBT friend or ally, and just being there for them, and stepping up when it seems like things may be not appropriate in either a classroom or a playground or on the bus, or just in a general place. believing that all people, regardless of their gender identity and sexual orientation, should be treated with dignity and respect. Having that belief and ingraining it in our everyday actions can speak volumes. So being able to treat everyone with respect regardless of what they're going through personally, would work wonders for our community, I'm sure. And then if you see LGBT people being mistreated, again, standing up, being that voice, being that advocate, stepping up and saying, that's unacceptable, that can be pretty hurtful, harmful, or I don't appreciate what you said or what you've done. So there's many places that we can go in our community for resources and support. Some of them are online, some of them are agencies in which you can go to for counseling, for medical help, services. One of the places in which we can go to is the SAFE committees. It's a Service Alliance for Equality, which is actually a coalition of individual agencies that sit around a table and advocate on behalf of LGBTQ youth and their family. So pulling all of our resources together as professionals, and then we've designed a website for anyone, professionals, individuals who have come out, individuals who are in the coming out process, allies as well. And parents and other family members can get information and resources from this website. It's safewindsor.com. And it is meant to be a directional signpost for people in our community, just to get resources, information, and hopefully help steer them in the right direction in terms of getting help medically or spiritually or for counseling or whatever that might be for that individual. There's also lots of just reading resources and other supportive agencies listed on that website as well. The Windsor Family Health Team is an organization in Windsor in which people can go to for services, whether it be medical or counseling, and there's great resources in terms of group called Gender Journeys that can be accessed through that agency as well. The Windsor Essex Community Health Center is an organization that has many different locations across the city and the county, and one in particular that is for teens 12 to 24 that can access medical, counseling, nutrition services, and very good people at individuals supporting those who identify as LGBTQ youth. Family Service Windsor has counseling available throughout the city and some satellite areas in the county. And Young and Proud is located within the AIDS Committee of Windsor, and it's a group specifically for young people who identify as LGBTQ. It's support, it's social. I believe they meet weekly and either have an open group or an agenda. You can contact the AIDS Committee of Windsor for those resources as well for support. There are many different organizations that are within organizations, or I should say support groups within organizations. Some of them have to be contacted through, accessed through those individual agencies such as the AIDS Committee of Windsor. There's groups called Trans Spectrum, which have to be accessed through, again, those individual organizations as well. So feel free to call any of those places to get more information or look online, and you should be able to get the help and support that you might need.